where the luminal contents want to go to the connective tissue, or connective tissue content wants to come to the lumen. So the classical area where this will be present is alveoli of lungs. They are also present in the outer layer of Bowman's capsule of kidney. Remember, kidney filters out 125 ml of fluid per minute, which comes to 180 liters per day. Out of which 178.5 liters are reabsorbed. That is 124 liters have to be reabsorbed per minute. So the filtering out is by ultrafiltration, and reabsorption is by the outer layer of Bowman's capsule. That acts as a minimal barrier, that most of the fluid are removed there itself, taken back into the body there itself. Why is it called ultrafiltration? It's like what you call it as ultra cleaning. You know, when you are asked to clean the inside of your cupboard, you put some dusting here and there, try to arrange the books decently, that's cleaning. But when it comes to ultra cleaning, it's like something that you do once in a vacation. You take out all the books then clean the cupboard, then place the books back. This is called ultra cleaning. So ultra filtration is something like that. Take out 124 ml of fluid, 125 ml of fluid, then select back in what you want, 124 ml plus certain substances which you got filtered out. So that outer layer of Bowman's capsule, all mesothelium, all endothelium are simple squamous. Endothelium and mesothelium are basically separating interior from interior. So there is not very thicker barrier required. Simple squamous is sufficient enough. And when it comes to capillaries, there are exchange of nutrition. Automatically it has to be simple squamous. If it is simple squamous for capillaries, it is simple squamous for all the vessels. Because after all, either 29 layers of tunica media get the nourishment directly from the lumen. So simple squamous. Peritoneum, pericardium and pleura have some fluid between the two layers. These fluids are secreted from the connective tissue. They are reabsorbed also by the epithelium itself. So that lubricating fluid which enters the lumen and the reabsorption and exchange of that lubricating medium is also by the same mesothelial cells. Automatically, simple squamous is the best bet. When one of the two is diseased, the other composites and secretes extra. So what will happen is inflammation of peritonitis, pleuritis or pericarditis will cause excessive accumulation of fluid within them. This will be called as pericardial effusion, pleural effusion and ascites. for peritoneal epithelium. ASCITES. So this is about simple squamous epithelium. If the height, width and length of the cell is nearly equal, and the cells are roughly cubical in shape, these are called as simple cuboid epithelium. OID is a Greek word which in Latin is translated as I form, IFORM, which is translated to English as similar to. OID Greek is equal to I form, IFORM is equal to similar to. IFORM. Yeah, those cuneiforms and such words which are there, wherever there is I form, which is a Latin word. So because cuneus is a Latin word, cuneiform. Because scaphos is a Greek word, scaphoid. There is a Greek word you add OID, there is a Latin word you add I form. Both means similar to. So because these are similar to the cube, they are called cuboid. And obviously that implies that cube is a Greek word.
So rhomboid is
Rhombus is a Greek word. See, the word angle is Latin word. So triangle, quadrangle. Whereas the word hedron or ogon is a Greek word. So tetrahedron.
hexagon.
Pentagon, hexagon are all Greek words. Penta, hexa is Greek. Quinta is Latin. So conveniently, three-sided figure is called triangle, Latin. Four-sided figure is called as quadrilateral or quadrangle. Five-sided figure should have been called as quintangle. But we conveniently change the language and call it as pentagon. Right. The cubical shaped cells are relatively inactive cells. When you compare it with the columnar epithelium. These cubical cells are classically seen in renal convoluted tubules. And they are also seen in medium-sized ducts of secretory gland. The nucleus in this will be centrally placed. third variety of epithelium is called a simple columnar epithelium. The height of the cell is more than its other dimensions. The height is roughly 14 microns. That is twice the height of an RBC. The nucleus is usually basal. They occupy the lower one-third of the cell. A variant of the columnar cell, where the nucleus is elongated and becomes more than the half the height of the cell. When the nucleus is elongated and becomes more than the height of the columnar cell, such columnar cells are called as tall columnar cells.
Sir, half the height.
Half the height, more than, otherwise it occupies the lower one-third. When it exceeds more than half the height of the columnar cell, it's called as tall columnar cells, seen in gallbladder. So when we say the word tall columnar cell, it's not that the cells are tall, it's that the nucleus is tall. So you should have called it as tall nuclear cells, but we call it as tall columnar cells. Columnar cells shows a lot of apical modifications. They show a lot of lateral modifications. And they have the usual hemidesmosome on the basal side. What are the apical modifications? One of them is that the surface is covered by an acid-resistant mucus coat. This is seen in stomach. So there is an acid-resistant mucus coat. Then it will show hair-like processes.
Lateral.
Apical itself. Either it will show an extra thick layer of coat, which is an acid-resistant mucus coat, or the apical surface can show hair-like processes, which are called cilia. Which are motile processes, classically seen in respiratory tract, but are also seen in female reproductive tract. So what is the function of this cilia?
To move, push.
It's like a broom,
Okay,
but
surface area increase.
no,
Move it.
this is a broom. Now in a broom, if you try to wipe a broom,
Boom.
there is something called as a beating stroke and then a recovery stroke. And beating stroke and recovery stroke are not similar to each other, otherwise you just scatter the dust. So beating stroke is along the wall, then you pick up, go back to the little space, beating stroke again. So recovery stroke is different from a beating stroke. All those things are seen in the cilia. So it's meant for unidirectional pushing of the content. These ciliated epithelium are also seen in ependyma lining the ventricles of the brain. But there, the cells are only cuboidal. Ependymal cells are cuboidal. They are not tall, that's why they are cuboidal, but they still show the same modification, which is called cilia. Next question. In what direction do cilia meet in the respiratory tract?
Towards
Towards the
cab, towards the outer opening.
Cilia in respiratory tract meets towards oropharynx. So in the nasal passages, it meets backwards. In the nasopharynx, it meets downwards. In larynx, it meets upwards. In the entire respiratory tract, it meets towards trachea. Remember, I am using the word towards trachea because there are some upper bronchi which are above the level of trachea. They will meet downwards. There are some lower bronchi which will meet towards the trachea, which is upward. So I am not using the word upwards or downwards inside the lung. They are meeting towards trachea. And in the nasal passage it meets backwards and larynx it meets upwards or towards oropharynx. What does it meet? It meets the mucus. What does the mucus do? Mucus traps the dust particles. So the mucus has to be meted out. From the oral cavity, it can be spit out. When there is excessive secretion in the nasal passages, then it runs out to the nostril. Cilia are rapidly trying to beat it backwards. But too much excess production, more than what the cilia can tolerate, then it will run out through the nose. So you get running nose. In what directions do the cilia meet in the female reproductive tract?
From the ovary towards the female reproductive tract.
Fallopian tube. Inside the fallopian tube.
Yeah, but
From
in which direction does it
ovary,
meet?
ovary to the body.
Ovary to the uterus. So the fertilized ovum or unfertilized ovum has to be beaten towards the uterus. So that is done by the cilia. Spermatozoa go in the reverse direction, but they are self-motile. Spermatozoa contains one motile structure which is called flagellum. Flagellum is a cilia in structure. Because it's a single structure, it is given the name flagellum. Because these are multiple structures, they are called cilia. Because cilia means hair-like. The word cilia is also referred to eyeball. Initially, cilia was referring to the eyelashes, hair-like eyelashes. Now the whole eyeball is called as cilia. That's why if there is a nerve called nasociliary nerve, it supplies nose and eyeball. Okay? But otherwise cilia refers to these hair-like processes which are seen on the surface of usually columnar epithelium.
Why? So what is the reason? Like why is eyeball is called as?
Because eyelashes,
So entire eye. So entire eye will be called.
eyelashes were called as cilia first, then the whole eye was called as cilia. Extrapolation. There are other words also for eyeball. There are ocule, then ophthal, now one more word, cilia. Problem is, there is an oculomotor nerve supplying the muscles to the eyeball. There is an ophthalmic nerve carrying sensations to the eyeball. One of its branch, ophthalmic nerve, which supplies the eyeball, cannot be called as ophthalmic nerve because ophthalmic nerve also supplies forehead. So the branch of the ophthalmic nerve which supplies the eyeball, which also supplies the nose, is called nasociliary. You have to use different words. You can't say ophthalmic nerves, ophthalmic branch. And you can't use the word ocule because it's already given to another Kundalini. So think of a third word and give it that name. So female reproductive tract we spoke about, it leads towards the uterus. Does the uterus itself contain cilia?
No.
Prepubertal uterus contains cilia. Once the menstrual cycle starts, the ciliated cells are shed off.
So where is the ciliated cells there? All over the all through the
Throughout the
lining.
uterus. It is still present in the cervix, and they all beat outwards toward vagina. Because the uterine endometrium is shed off and new cells develop, few of them show cilia. Not all of them. Because it takes time for the cilia to grow. So uterus will show only patchy cilia. But cervix shows cilia, which beats it outwards. In what direction do the cilia beat? In the cavities of the brain? Towards fourth ventricle. From where? Through foramen of Magendie and Luschka is pushed out into the subarachnoid spine. All CSF which are produced in the ventricles are transported in the cavity, beats towards fourth ventricle. So even in the spinal cord, they beat towards fourth ventricle. So the circulation is maintained. Otherwise the CSF will become stagnant. Just to allow maintenance of circulation, the cilia is required. But because CSF does not offer much resistance, after all it's just water, the cells which are beating the cilia are not very active cells. So they don't require large size. Cuboidal cells is sufficient. The cilia beating is a very active movement. So when it's beating against resistance, like the mucus of the respiratory tract, they will require large amount of mitochondria, which gives the energy for the cilia to beat. It is there for those organelles that the cell has to be columnar. The epidermal cells of the brain are not very active because their beating is not against some great resistance. And even if it bleeds slowly, it is okay. And that's why those cells remain cuboidal. Okay. Another modification, and how many cilia are there in one cell of the respiratory tract? We generally show, when we show the diagram, some 8 to 10. On one cell of the respiratory tract, three-dimensionally, there are approximately 300 cilia.
How many, sir? 300.
300. So in a cross section, obviously you will not see all 300. You will see around 15 or so. But we still sometimes draw 2-3 strands and call it a ciliated epithelium. With cilia are 2 or 3 in one section, that means it will be around 10 or so in 3 dimension. No use. 300 or so. Another surface modification is the epithelial apex is thrown into folds. When it is thrown into folds, it increases the surface area. When it increases the surface area, they are classically placed in small and large intestine. This folded structure is called as microvilli. Remember, stomach does not show microvilli. That means the absorptive capacity of stomach is much lesser. But small intestine and large intestine show microvilli, so they will absorb. But we have heard large intestine absorbs mainly water. Much of the nutrients is already absorbed by the small intestine. Now I have a question. One person has got small bowel disease and is small intestine. Another person has got a large bowel disease. One of the two have got watery diarrhea, the other has got semi-solid diarrhea. Match the column.
Large intestine, watery diarrhea. And small intestine, loose stools.
It's watery. I feel like both large intestine.
Both?
Because diarrhea, no?
Diarrhea.
So then it's watery,
Watery diarrhea is?
more watery. Large intestine.
That's what they all also say. If that was the answer, I would have asked the question. Small intestine shows watery diarrhea. Large intestine shows semi-solid diarrhea.
Yes.
Why? %90 of the water is absorbed by small intestine. Because of their enormous length, because of villi, because of plica circularis, all of these increase the surface area of small intestine enormously. The extra length, 6 meter long. 90% of the water is absorbed by small intestine. 10% of water is absorbed by large intestine.
But large intestine only absorbs water.
Mainly absorbs water.
Absorbs water.
So when we use the word only, that placement of the only is critical. Large intestine absorbs only water. Not only large intestine absorbs water. We have placed the word only in the mind. In the mind we have played only in the wrong place. Small intestine absorbs 90% of the water and also nutrients and a lot of other things. The balance 10% is taken by the large intestine. If the large intestine does not become functional, then we extra 10% loss of water. That makes it semi-solid diarrhea. Whereas small intestine, if it doesn't absorb 90% of the water, how much can large intestine absorb? 10%. 90% water will go out. That will make it very watery diarrhea. Are you getting the point? Gastroenteritis can kill a child by dehydration. What is gastroenteritis?
Stomach and intestines.
Stomach and small intestine.
Small intestine.
Because the large intestine disease is called as colitis. Amoebic colitis produces a semi-solid diarrhea. Not enough to kill a person. Gastroenteritis can cause so much dehydration that it can even kill the person. These diarrhea are usually a part of food poisoning. Something that you have eaten doesn't suit your body. So some intestines get irritated and they don't do their function properly. Some people vomit. Some people have diarrhea. The same food they have eaten. Why do some people vomit it out? Some people have loose motions. There's something called as J point. J point in the GI tract. Accumulated food before the J point will be vomited out. Accumulated food which has crossed the J point will be passed off as stools. This J point varies from person to person and condition to condition. Same person can have a different J point in different conditions. So a person with high J point usually does not vomit. Whereas those with low J point usually is likely to vomit more than those with a high J point. Of course, food poisoning usually passes quickly and crosses the J point. That's why it more often causes diarrhea rather than vomiting. But if food is really rotten, then it will be vomited out as well. Okay? Coming back to microvilli. Because of this fold, the surface area is increased. By how much times?
5.
The surface area is increased 30 times. 30 times. That means 29 out of 30 parts of the microvilli are along the sides and only 1 out of 30 is on the surface. So these are finger-like projections where sides of this finger is 29 upon 30. The tip of the finger is only 1 upon 30. There are similar folds in the brain as well. They are called sulci and gyri. If the brain is flat, it's called lissencephaly. The surface area is lesser. If the brain shows folds, the surface area increases. But how many times does the surface area increase? Because of the sulci and gyri. Three times. So 2 lies in the wall of the sulcus, 1 lies on the surface. Okay, here it is 30 times. Somehow the number 3 fascinates me. There are 300 cilia. Surface area increased 30 times. In the brain it has increased 3 times. How many microvilli are present on a single columnar cell of the small intestine? Around 3,000. 3,000. These microvilli are also present in the convoluted tubules of the kidney. Which we have said are cuboidal cells.
Yes, sir.
the microvilli are very in number, especially in proximal convoluted tubule, that it appears like a paintbrush. In a paintbrush, you can see how many bristles are there. Plenty. The microvilli also look like that. So in the kidney, they are called as brush border epithelium. Brush border. You could have called brush border even in intestine, but just to differentiate, we call this intestinal microvilli as striated border. But remember, striated border and brush border are often interchangeably used. Doesn't matter what you call them. But traditionally, just to differentiate, we call kidney as brush border epithelium, intestine as striated border. Okay? 3,000 lie on the surface of one epithelium. These finger-like projections are not as tall as the cilia are. So cilia will be seen as hair-like projection outside the surface of the cell. These are just seen as, under light microscope, just seen as if the border is thickened. So you don't see the finger-like projection under light microscope, even under 1000 magnification, because they are so tightly packed that they just appear as the surface has become extra thick. Okay? Only under light microscope they can be seen like eye. Only under electron microscope they can be seen like finger. Okay? Another type of modification, apical modification of columnar cell is it shows long projections like the cilia, but they are not motile. They are physically elongated microvilli. They are physically elongated microvilli, but are called as stereocilia. Stereo. What does the word stereo mean?
False. Stereo.
The headphones and all those things.
Yes, sir.
The word stereo means solid, solid. So these are non-motile, na? So they are called solid. Solid cilia, stereocilia. Stereocilia are seen in male reproductive tract.
Female.
Male. These stereocilia are also seen in the internal ear. Where a single cell has got one immotile cilia, microvilli, the other has motile microvilli. one immotile microvilli and the other movable microvilli. So based on whether the motile ones move away from the immotile one or they move towards the immotile one, based on that sound perception and transmission will occur. Paradoxically, because they did not know much about Latin and Greek, the motile microvilli in the internal ear were called by physiologists as stereocilia, and the immotile one as chirocilia, which should have been the other way around. Kinetics movement. But they didn't understand so much about Greek and Latin. So enlarged microvilli we told them stereocilia. And would have called it as correctly. But they called the motile one as stereocilia, immotile one as chirocilia. So we have seen 4 surface modifications. A little extra thick mucus coat, which is acid resistant mucus. Along with the tall columnar cells, there are a special variety of columnar cells often situated with the ciliated epithelium. This special variety of columnar cells look like a wine cup, a hollow above, a short stem and a base. So because it looks like a wine cup, it is called as goblet cells. So in the respiratory tract, along with the ciliated epithelium, there are these specialized epithelium, which are also columnar. However, they do not possess cilia. They instead contain mucus. These mucus secreting cells are called as goblet cells. And because this mucus is washed off in tissue preparation, the cells look like an empty cup. Goblet cells secrete mucus, which protects the lining from the enzymes. Stomach contains acid, but has no goblet cells. Stomach is conspicuous by the absence of goblet cells when its cell wants to get protected from acid. So why does stomach not have any goblet cells? It has got cells that secrete mucus. They are called as mucus secreting cells. But if goblets also secrete mucus, why should stomach have another mucus secreting cell? The goblet cells secrete mucus which are protective in alkaline medium, not in acidic medium. The stomach mucus cells produce such consistency of mucus which are protecting against the acid. And these goblet cells, therefore, start from duodenum and increase all the way up to the rectum. That means you can say duodenum has got more absorptive cells, few secretory cells. As you proceed further and further away, more and more goblet cells, less and less absorptive cells. Till rectum, you can say, practically contains only mucous secretory goblet cells. This is what gives the semi-solid consistency to the stools and makes it easier to pass. Otherwise, if a large vessel absorb 10% water, the stools will become solid. If small intestine is already absorbed 90% water. So you require mucus to the stools. That's done by the increase in goblet cells in large intestine, largest eye in rectum. Compound epithelium. No, one more simple epithelium. Earlier people used to identify whether the epithelium is simple or compound based on the level of the nuclei. If the nuclei lie in one layer, the cell is also one layer. If the nuclei are in multiple layers, the cells are also multiple. Because they could not identify boundaries of the cells. They could only see the nuclei. So nuclei in multiple layers, multi-layered epithelium, compound epithelium. But there are some epithelium where some are shorter cells, some are taller cells, and the nucleus near the upper part of the taller cells and the center of the shorter cells. All cells rest on the basal membrane. But the shorter cells have lower level of nuclei, the taller cells have higher level of nuclei. So it appears like multi-layered, but they are actually simple. Such type of epithelium are called as pseudo-stratified columnar cells. That columnar cell may have cilia or maybe a goblet or maybe some ciliated and some goblet. So you call such epithelium by its complete name pseudostratified ciliated columnar cells with goblet cells. Pseudostratified ciliated columnar cells with goblet cells. This is the epithelium of the respiratory tract. We have already said in which direction do the cilia meet. The question is, in alveoli of the lungs, there are neither ciliated cells nor there are goblet cells. That is, both have stopped before the division of the lungs reaches alveoli. That means they are present only in bronchus and bronchioles. Question: ciliated cells stop at some particular time. Goblet cells stops at some particular time. Which one stops earlier? The goblet cells. Because whatever mucus is secreted has to be beaten out. Both will terminate at nearly the same point, but there will be few additional cilia beyond the last goblet cells. Otherwise, if there are a few goblet cells beyond the last ciliated cell, that goblet would have closed the lumen of the respiratory passage, and everything beyond that will collapse. Okay? So there has to be a few ciliated cells beyond the last goblet cells. In the alveoli of the lung, there are two types of cells. One is the classical simple squamous epithelium for gaseous exchange. The simple squamous epithelium, which is also called as pneumocyte type 1. The simple squamous epithelium for gaseous exchange, called as pneumocyte type 1. But there are some cuboidal to columnar cells within the alveoli of the lung, which are called as pneumocyte type 2. These secrete surfactant, which is a surface tension reducing agent. Pneumocyte type 2 are cuboidal to columnar cells which secrete surfactant, which is a surface tension reducing agent. Remember, the alveoli add to the surface area of the lungs. If the alveoli coalesce, the surface area will reduce. The surfactant prevents the alveoli from coalescing into multiple alveoli to coalesce into one alveoli. Okay? A tricky question. Alveoli contain more pneumocyte type 1 or type 2? If it was 1, it's not a tricky question. Number wise, type 2 is more. But they occupy much lesser space. The type 1 occupies 97% of the alveolar surface. Only 3% are reserved for type 2. But those 3% contain some 8 to 10 cells, whereas only 2 or 3 cells, squamous epithelium, line the 97% of the alveoli. Because squamous epithelium is highly stretched. So 2-3 cells is sufficient to cover a single alveolus. And the 3%, there are some 8 to 10 short cells. So number wise, type 2 is more. But surface area wise, type 1 beats hands down. Okay? Compound epithelium. So it goes without saying, all cells do not touch the basement membrane because they are multi-layered. Automatically, all cells do not reach the lumen also. And there are some cells which neither reach the lumen nor the basement membrane. Okay? So here the polarity will be the surface cells will have an apical and lateral surface. Surface cells will have an apical and lateral surface. The basal cells will have a lateral and basal surface. And the middle cells have all lateral surface. Is it clear? The polarity. The surface cells will have one luminal and one lateral surface. The basal cells will have one basal surface, one lateral surface, and the middle cells will have only lateral surface. If cells from the base keep growing, multiplying, and becoming middle surface, and then the middle surface keeps multiplying and becomes the surface cells, and the surface cells are shed off. If this process continuously occurs, such type of compound epithelium are called as stratified epithelium. That means basal surface have to replace the middle surface replace the apical surface, and apical surface are shed off. This is called as stratified epithelium because there are different strata which are replacing each other. Basal cells replace middle cells replace surface cells, and surface cells are shed off. So if there is an abrasion, what is an abrasion? Does it bleed or does it not bleed? If the cut is restricted to the surface epithelium without reaching the basement membrane, obviously it will not bleed because blood vessels lie below the basement membrane. So that superficial cuts are called as abrasion. In stratified epithelia, if there is an abrasion, there is no scar formation because the basal cells are going to replace the cut area. So it will become as perfect as normal. Okay? But that's only in stratified epithelia. So examples, stratified epithelia are named based on the shape of the surface cells. When we say stratified squamous epithelia, it means the surface cells are flat. Basal cells can be cuboidal or columnar, but if the surface cells are flat, we call it as stratified squamous epithelium. Stratified squamous epithelium are also called as wear and tear epithelium. Wherever there is a lot of friction, the epithelium will be stratified squamous. Wear and tear or stratified squamous epithelium are of two subtypes, dry and moist. In a dry epithelium, the surface cells cannot survive. So they are basically dead cells. Dead cells are made up of primarily a protein called keratin. So we call that dry stratified squamous epithelium as keratinized stratified squamous epithelium. Seen in skin. The moist wear and tear epithelium is where there is moisture in it, so the surface cells are alive. They are called as non-keratinized stratified squamous epithelium. When we say dry like skin, we have to exclude sweat secretion, sebaceous secretion, which are always there, but minimal. Moist wear and tear epithelium are seen in oral cavity, pharynx, and esophagus. cavity, pharynx and esophagus. So there is sufficient liquid to keep it moist. Because there are mucous glands. What about the lips? It is a junction between skin and mucus. The skin and lips neither contain glands nor do they contain sweat glands. Neither contain mucous gland nor sweat glands. They often become extra dry when its vascularity decreases as in fear of the exams. So often in Viva, you quickly lick your lips to make it moist. Because that fear has decreased the sweat secretion, has decreased the salivary secretion, makes the lips extra dry and too much of friction. Okay. Silence. So two types of stratified squamous epithelium, keratinized and non-keratinized. If the surface cells are columnar, it's called as stratified columnar. Usually, these are only two layers. The basal layer is cuboidal, surface layer is columnar, two layers. These are seen in large ducts. Theoretically, there can be stratified cuboidal also. Where basal cells are cuboidal, surface cells are also cuboidal. We'll ignore this type of epithelium. Specialized type of compound epithelium occurs where there is a basal cell, there is a pyriform cell, inverted pear-shaped. So the gaps between basal cells is where the narrow part of the pear is fixed, and then the pyriform shape bulges outwards. Both are rest on basal membrane. But there is a third layer of cell which is lying on the top of the pear-shaped cells. And they are shaped like an umbrella. Umbrella-shaped cells. So three types of cells. Basal, resting on basal membrane. Pyriform, resting on basal membrane. And umbrella-shaped cells, not resting on basal membrane. And that pair are of different heights. Some tall, some medium size. Basal cells are always short. So you can have basal cells, multiple layers of pyriform cells, but one layer of umbrella-shaped cells. Okay? That umbrella-shaped cells was found to have extra thick surface, luminal surface. So under higher magnification it was found that an extra thick surface lining is made up of glycocalyx coat. So there are plates of glycocalyx which are thrown into folds. When this epithelium is stretched from side to side, the pyriform cells will get pushed down. So instead of that Multilayered pyriform cells, now it will be liver or two-layer pyriforms. All the pyriform get flattened out. Basal cells remain as they are. The surface cells also stretches out, umbrella-shaped cells. But the glycocalyx coat, which was like plates, crumpled plates, folded on each other, now open out. When they open out, there is a uniform glycocalyx coat still present over all the cells and the intercellular junctions. This type of epithelium is urine proof. The epithelium is called urothelium. Okay? Earlier, wrongly called as transitional epithelium. It is not a transition between anything. It is exclusively present in the urinary tract because that additional thick coat of glycocalyx makes it urine proof. Urine in terrestrials is a highly concentrated liquid, especially people drinking less water. High concentrated liquid and living cells surrounding it. What it will do? It will draw the fluid from the cells to by osmolarity, to make it, trying to make it equal. Obviously the surface cells will die. This is the only epithelium which can tolerate the most concentrated urine, because the glycocalyx coat is impermeable to either solvents or solutes.
What was the name?
Urothelium. Or formerly called transitional epithelium. Remember, the basal cells when they grow, they can form pyriform cells. Pyriforms, when they get flattened, they will form lesser layer of pyriforms. But the umbrella cells are not replaced by the basal or pyriform cells. They are specialized cells altogether. So that means the basals don't replace the surface. Okay? So they are not stratified. They are compound. The word compound means either the basals will replace the surface or they will not replace the surface. If they replace the surface, stratified. If they don't replace the surface, they are not stratified. They are compound. The thing is, most of the compound epithelium are stratified, with the exception of urothelium. That is why some people use compound is equal to stratified. And they say one of the varieties of stratified epithelium is urothelium. So you should understand they are using the word stratified loosely. It's not correct, because the definition of the word strata means layer by layer, and in every case the lower layer must replace the surface layer. And everything the word, but here they don't. But calling it stratified is misnomer. Calling it compound is accurate. But then people, as you said, loosely equate compound with stratified because most of the compound are stratified. So this is about epithelia. Any questions?
So drawing the urothelium, we first draw the, while drawing the urothelium, it looks like only the basal cells are resting on the basal membrane.
In endothelium?
I know, while drawing the histology diagram, I was thinking only the basal cells.
I don't know. All cells touch the basal membrane, pyriform as well as basal. Umbrella cells don't. The thing is, it doesn't appear so because the gaps between the basal epithelia are so narrow that you don't see it. But it's the basal which has replaced the pyriform without detaching from the basal membrane. And the pyriform are of different heights to give rise to multiple layer of pyriform. But they all touch. See, what you can see, this is one basal, this is another basal. I don't see any gap in it. But it may be behind the basal. They all touch. Upper substance node. Okay. Any other questions? Shall we stop here?